When I went home at night 15 years ago, I would take home 5 charts. Now I take home 1,800 charts. You're always connected to your computer, day and night. We're always getting results, lab results that are abnormal. So we're always connected, and it makes you feel like you can never really step away, and that's added to our burnout.
Have you got a family doctor? Me neither. Despite being on a wait list for around 3 years now, I'm one of the roughly 6 million Canadians that relies on walk-in clinics, urgent care clinics, and emergency rooms for primary care. And those facilities are packed right now with overlapping waves of seasonal flu, RSV, and COVID. Those that work in the medical field have said for years now that a reckoning is coming.
We're all trying to retire early. That's what we talk about. How can we get out of practice? Office-based practice is where a lot of the stress is.
Dr. Kathy Mastrogiacomo was working an evening shift to cover for a colleague, but was able to spare 15 minutes to talk to City News about what the front lines of healthcare are like.
I saw at least 4 or 5 people off with coughs and colds, and some needed medication, some didn't. Most of them are viral. But of course, they need to be seen.
Add to that an increasing administrative workload and patients with multiple issues.
Honestly, when I started practice 30 years ago, people would come in with one thing. Now they come in with a list, literally a list. Doctor, I have 5 things to talk about. And when you're dealing with 5 different things, how many patients can you see in a day?
And many family doctors aren't paid for how many patients are on the books, but per visit.
I think it's $37 maybe for that visit. So you can imagine, out of that $37, they've come in with multiple issues. You have to pay your secretary, you have to pay your disability insurance, you have to pay your income tax, your supplies, your internet, your phone. Everything comes out of that $37.
Team-based cares tend to be funded in a different way. The technical term is capitated. Basically what it means is you get funding for the size of your practice in addition to the number of patients you see, for example, in a day.
Dr. Danielle Raza is also a family doctor, but he works in a team-based model, not solo practice. That means workload is spread among a team of doctors, nurses, pharmacists, and other staff. If a patient needs to see someone after hours, it'll be with someone scheduled for then, not a doctor working a double shift. He says the team-based model must be the new standard of care, but less than 25% of Canadians currently see a doctor this way.
We don't really have some of the most basic information that would allow us to understand, who is working, what they're doing, and what their practice intentions are.
The Canadian Institute for Health Information says there are more family doctors than ever, but Dr. Tara Kieran says available data is so spotty, we don't know how much those doctors do. Some regions might only have doctor headcounts, with no distinction between a doctor with 1,800 patients and one close to retirement with only a handful. Some suggest more med students should specialize in family medicine, but a family medicine specialist has other, more appealing options.
They are choosing, for example, to become a hospitalist, or is focused on palliative care, or work in the emergency department, or practice sports medicine.
They see the grind. They see what we go through day in, day out.
A recent health summit between the federal government and provinces and territories ended with no deal. Provinces wanted more health funding. The federal government wanted better data collection on health. Dr. Raza says at least both sides are asking for the right things. He says funding is a problem, but there's more to the issue.
I don't want to oversimplify it, right? You can't just cut a check and expect things to get better, because you need to back money with a plan.
You do have to have a willing partner. The government has to be able to help us with the funding. If they provide us with the funding, I could hire a nurse, right? I could hire a physician assistant. Right now, we can't even get locums to cover us for holidays.
In Ottawa, Xiaoli Li, City News.